Greetings, Wally's nursing videos, enthusiasts and eager learners. Today, we embark on a captivating journey, exploring various topics in drugs affecting the renal and digestive systems ranging from fluid volume excess to treating diarrhea. Get ready to dive into the intricate world of medications and therapeutic interventions. I'm your guide, Wally, and I'm thrilled to be your companion on this enlightening expedition. Are you ready to uncover the mechanisms, side effects, and contraindications of pivotal medications in patient care? From managing cardiovascular health to tackling respiratory challenges and beyond, we're delving into a wealth of knowledge that will empower you in healthcare. Let's embark on this educational adventure together. Don't forget to hit that subscribe button and tap the notification bell so you never miss out on our enlightening content. Whether you're a nursing student, a healthcare professional, or simply curious about the world of medications, Wally's Nursing Videos is your trusted platform for comprehensive insights. Drug therapy for fluid volume excess. In this section, we dive into managing fluid volume excess, a crucial aspect of patient care. We'll explore common diuretics like furosemide and spironolactone and provide you with tips to identify them quickly. These medications can significantly impact a patient's fluid balance and overall well-being. Now let's immerse ourselves in the realm of fluid volume excess management. Fluid balance is a fundamental aspect of patient care, and medications like diuretics play a crucial role in achieving equilibrium. Mechanisms of action. Diuretics, such as furosemide and spironolactone, help the body eliminate excess fluids and sodium. Furosemide is a loop diuretic that acts on the loop of Henle in the kidneys, while spironolactone is a potassium-sparing diuretic that affects the distal tubules. Commonly used drugs: furosemide, loop diuretic; spironolactone, potassium-sparing diuretic. Identification tip: diuretics often end in "ide" or "1". Furosemide is recognizable by its unique furo prefix, while spironolactone has a distinctive spirono component. Side effects: furosemide may lead to dehydration, electrolyte imbalances, and low blood pressure. Spironolactone might cause hyperkalemia, gynecomastia in males, and menstrual irregularities in females. Contraindications: furosemide should be used cautiously in patients with kidney impairment and electrolyte imbalances. Spironolactone may be unsuitable for patients with severe kidney dysfunction and high potassium levels. Understanding these mechanisms, potential side effects and contraindications equips healthcare professionals with the knowledge to manage fluid volume excess effectively. Nutritional support products, vitamins, and mineral supplements. Nutrition is a cornerstone of healthcare, and in this chapter, we uncover the realm of nutritional support, vitamins, and mineral supplements. From vitamin D to iron supplements and calcium products, we'll guide you through these essential elements contributing to patient health. Let's discuss nutritional support, vitamins, and mineral supplements. These essential elements contribute to patient health and well-being, making them fundamental in healthcare practice. Mechanisms of action. Nutritional support products, vitamins, and mineral supplements provide essential nutrients that may be lacking in a patient's diet. Vitamin D supports bone health and immune function. Iron supplements combat anemia, and calcium supplements promote bone strength. Commonly used products: vitamin D, iron supplements, calcium supplements. Identification tip: vitamins often have distinct letters in their names. Its D designation recognizes vitamin D. Mineral supplements like iron and calcium are named after the minerals they contain. Side effects: vitamin D in excessive amounts can lead to hypercalcemia and kidney stones. Iron supplements may cause constipation, nausea, and dark stools. Calcium supplements can result in constipation, kidney stones, and interference with the absorption of other minerals. Contraindications: vitamin D should be used cautiously in patients with hypercalcemia and kidney disease. Iron supplements are contraindicated in patients with hemochromatosis. Calcium supplements should be avoided in patients with hypercalcemia and certain kidney conditions. Understanding these mechanisms, potential side effects and contraindications empowers healthcare professionals to provide holistic care by addressing nutritional deficiencies. Drug therapy for weight management. Weight management is a multifaceted challenge, and medications can be vital in supporting patients' journeys. We'll discuss agents like orlistat and phentermine, providing you with easy ways to recognize them. These medications can have a profound impact on patient weight and overall well-being. Now let's explore how these medications can play a pivotal role in supporting patients' journey toward a healthier weight. Mechanisms of action. Weight management medications target various pathways to assist patients in achieving their weight goals. Orlistat, for instance, inhibits fat absorption in the intestines, leading to reduced caloric intake. Phentermine acts as an appetite suppressant, helping patients consume fewer calories. Commonly used drugs. Orlistat, weight loss agent. Phentermine, appetite suppressant. Identification tip. Weight loss agents like orlistat often end in stat. Appetite suppressants like phentermine have a unique name that stands out. Side effects. Orlistat can lead to gastrointestinal discomfort, oily stools, and vitamin deficiencies. Phentermine may cause increased heart rate, elevated blood pressure, and insomnia. Contraindications. Orlistat should be avoided in patients with chronic malabsorption and gallbladder problems. Phentermine is contraindicated in patients with cardiovascular disease, hyperthyroidism, and a history of drug abuse. Understanding these mechanisms, potential side effects, and contraindications empowers healthcare professionals to support patients aiming for healthier weights. Drug therapy for peptic ulcer disease and hyperacidity. Peptic ulcer disease and hyperacidity are common issues, and medications are critical in managing them. We'll delve into proton pump inhibitors like omeprazole and H2 blockers like ranitidine, offering tips for quickly identifying these medications. Understanding these drugs is essential for alleviating discomfort and promoting gastric health. Using medications, let's dive into the fascinating realm of managing peptic ulcer disease and hyperacidity. Let's explore how these interventions can provide relief and promote gastric health. Mechanisms of action. Medications for peptic ulcer disease and hyperacidity target the root causes of these conditions. Proton pump inhibitors like omeprazole suppress gastric acid production, while H2 blockers like ranitidine reduce stomach acid secretion, alleviating discomfort. Commonly used drugs. Omeprazole, proton pump inhibitor. Ranitidine, H2 blocker. Identification tip. Proton pump inhibitors like omeprazole usually end in prazole. H2 blockers like ranitidine stand out with their tidine ending. Side effects. Proton pump inhibitors can lead to vitamin B12 deficiency, bone fractures, and kidney disease. H2 blockers might cause headaches, diarrhea, and interactions with other medications. Contraindications. Proton pump inhibitors should be used cautiously in patients with osteoporosis and kidney impairment. H2 blockers are contraindicated in patients with a history of allergies to these medications. Understanding these mechanisms, potential side effects and contraindications equips healthcare professionals with the knowledge to alleviate discomfort and promote gastric health effectively. Drug therapy for nausea and vomiting. Nausea and vomiting can be distressing for patients, and medications can provide relief. We'll explore antiemetics like ondansetron and anti-nausea agents like metoclopramide, offering simple ways to recognize these crucial interventions. These medications can significantly improve patient comfort and well-being. In this segment, we're exploring the realm of medications that address nausea and vomiting, providing relief and enhancing patient comfort. Mechanisms of action. Medications for nausea and vomiting target different pathways to mitigate these distressing symptoms. Antiemetics like ondansetron block serotonin receptors in the gut and brain, while anti-nausea agents like metoclopramide enhance gastrointestinal motility. Commonly used drugs. Ondansetron, antiemetic. Metoclopramide, anti-nausea agent. Identification tip. Antiemetics like ondansetron often end in section. Anti-nausea agents like metoclopramide are easily recognizable due to their unique names. Side effects. Ondansetron may cause headaches, constipation, and changes in heart rhythm. Metoclopramide can lead to drowsiness, restlessness, and involuntary movements. Contraindications. Ondansetron should be used cautiously in patients with prolonged QT intervals and electrolyte imbalances. Metoclopramide is contraindicated in patients with gastrointestinal obstruction and a history of seizures. Understanding these mechanisms, potential side effects and contraindications empowers healthcare professionals to provide prompt and effective relief to patients experiencing nausea and vomiting. Drug therapy for constipation and elimination problems. Managing elimination problems is essential for patient comfort and health. We'll dive into medications like bisacodyl and docusate sodium, providing you with tips to identify them quickly. These drugs can play a vital role in promoting regular bowel function. This section covers the management of constipation and elimination problems, addressing a fundamental aspect of patient comfort and well-being. Mechanisms of action. Medications for constipation and elimination problems work through different means to promote regular bowel function. Laxatives like bisacodyl stimulate bowel movements, while stool softeners like docusate sodium make stools easier to pass. Commonly used drugs. Bisacodyl, laxative. Docusate sodium, stool softener. Identification tip. Laxatives like bisacodyl often have a distinctive name that stands out. Stool softeners like docusate sodium are recognizable due to their unique ingredient in the title. Side effects. Bisacodyl may lead to abdominal cramps, diarrhea, and electrolyte imbalances. Docusate sodium can cause diarrhea and abdominal cramps. Contraindications. Bisacodyl should be used cautiously in patients with inflammatory bowel disease and abdominal pain. Docusate sodium should be avoided in patients with intestinal obstruction. Understanding these mechanisms, potential side effects, and contraindications equips healthcare professionals with the knowledge to effectively manage elimination problems and promote patient comfort. Drug therapy for diarrhea. Diarrhea is a common concern, and medications can provide relief and management. We'll explore antidiarrheals like loperamide and bismuth subsalicylate, offering you easy ways to identify these essential interventions. Understanding these medications is crucial for promoting gastrointestinal health. Now let's delve into the final chapter of our medication exploration. In this segment, we're focusing on medications that address diarrhea, a common gastrointestinal concern that can significantly impact patient comfort and well-being. Mechanisms of action. Medications for diarrhea target various pathways to alleviate symptoms and restore bowel regularity. Antidiarrheals like loperamide reduce intestinal motility, while bismuth subsalicylate has antimicrobial and anti-inflammatory properties. Commonly used drugs. Loperamide, antidiarrheal. Bismuth subsalicylate, antidiarrheal. Identification tip. Antidiarrheals like loperamide often end in -ide. Bismuth subsalicylate is easily recognizable by its unique name. Side effects. Loperamide may cause constipation, abdominal discomfort, and dizziness. Bismuth subsalicylate can lead to darkened stools and temporary darkening of the tongue. Contraindications. Loperamide should be avoided in patients with severe abdominal pain and fever. Bismuth subsalicylate should be used cautiously in patients with salicylate allergies and certain medical conditions. Understanding these mechanisms, potential side effects and contraindications empowers healthcare professionals to provide prompt and effective relief to patients experiencing diarrhea. As we conclude our comprehensive journey through drug therapy, we've explored the intricate world of medications and their impact on patient care. From fluid volume management to gastrointestinal challenges, you're now equipped with insights that will shape your practice as a healthcare professional. Thank you for joining us on this enlightening adventure. Don't forget to hit that subscribe button and activate the notification bell for more educational content from Wally's Nursing Videos. Keep nurturing your passion for nursing, healthcare, and continuous learning. Until our next educational endeavor, take care and stay inspired. And there you have it, dedicated learners. We've embarked on a journey through diverse chapters, unveiling the intricate world of medications that impact patient care. As we bid adieu, let's recap the commonly used drugs from each chapter and how to recognize them easily. Drug therapy for fluid volume excess. Commonly used drugs. Furosemide, diuretic. Spironolactone, diuretic. Identification tip. Look for the "ide" or "1" ending in diuretics, and the unique furo and spirono components. Nutritional support products. Vitamins, and mineral supplements. Commonly used products: vitamin D, iron supplements, calcium supplements. Identification tip: spot the specific letters in vitamins and identify minerals and their names. Drug therapy for weight management. Commonly used drugs: orlistat, weight loss agent; phentermine, appetite suppressant. Identification tip: watch for the stat ending in weight loss agents and the unique name of appetite suppressants. Drug therapy for peptic ulcer disease and hyperacidity. Commonly used drugs: omeprazole, proton pump inhibitor; ranitidine, H2 blocker. Identification tip: spot the prazole and tidine endings in these medications. Drug therapy for nausea and vomiting. Commonly used drugs: ondansetron, antiemetic; metoclopramide, anti-nausea agent. Identification tip: look for the citron and unique name in these interventions. Drug therapy for constipation and elimination problems. Commonly used drugs: bisacodyl, laxative; docusate sodium, stool softener. Identification tip: notice the distinct names of laxatives and the ingredient in stool softeners. Drug therapy for diarrhea. Commonly used drugs: loperamide, antidiarrheal; bismuth subsalicylate, antidiarrheal. Identification tip: watch for the -ide ending and the unique name in antidiarrheals. As you continue your journey in healthcare, keep these identification tips in mind, and let your newfound knowledge guide you to provide optimal patient care. Thank you for joining us on this educational adventure with Wally's Nursing Videos. Remember to subscribe and hit that notification bell to stay connected. Keep nurturing your passion for nursing, healthcare, and continuous learning. Until next time, take care and stay inspired.